What do platelet levels mean in lymphoma? Imagine your blood as a busy highway with many different vehicles doing important jobs. Platelets are like tiny traffic controllers that help stop bleeding when you get a cut. When doctors check your blood with a test called a full blood count, they measure how many platelets you have. Normal levels are usually between 150 and 450 billion per liter of blood. In lymphoma, especially non-Hodgkin lymphoma, platelet levels can tell us a lot about how the disease is affecting the body. Sometimes the platelet count is low, which is called thrombocytopenia. This can happen if lymphoma cells invade the bone marrow, which is where blood cells are made. When the marrow is affected, it can't produce enough platelets, leading to a low count. Thrombocytopenia can also occur if the immune system mistakenly attacks platelets, a condition called immune thrombocytopenia, which can sometimes be triggered by lymphoma. Treatments like chemotherapy can also lower platelet levels further. Having low platelets can cause symptoms like easy bruising, bleeding from small cuts, nosebleeds, bleeding gums, or heavy periods. If platelet levels drop too low, the risk of serious bleeding increases. Interestingly, when lymphoma responds well to treatment and the disease shrinks or goes into remission, platelet counts often improve as the bone marrow recovers. Doctors pay close attention to platelet levels because low counts at diagnosis can suggest more advanced disease or involvement of the bone marrow, and this can sometimes mean a worse outlook. In aggressive lymphomas like diffuse large B-cell lymphoma, low platelet counts are considered an independent sign of poorer prognosis. On the flip side, sometimes platelet levels are high, a condition called thrombocytosis. Elevated platelets can occur in lymphoma and other cancers, often linked to more aggressive or spreading disease. High platelet counts can increase the risk of blood clots, which might lead to strokes, heart attacks, or deep vein thrombosis. Although less common than low platelets, thrombocytosis can also reflect increased inflammation or tumor burden. Monitoring platelet levels is a routine part of managing lymphoma. Regular blood tests help doctors see how the disease is progressing and how well treatments are working. If platelet counts are very low, doctors may take steps to prevent bleeding, and if they are high, they might look for signs of increased clotting risk. Both extremes requiring careful management to keep patients safe. In summary, platelet levels in lymphoma are more than just numbers. Low levels often point to the disease affecting the bone marrow and can indicate a more serious or advanced condition. High levels may signal active disease or inflammation and raise concerns about blood clots. Regular blood tests give doctors important clues about how lymphoma is impacting the body and help guide treatment decisions. If you notice any unusual bleeding or bruising, or if your blood tests show abnormal platelet counts, it's essential to discuss these findings with your healthcare team. Always remember, each person's experience with lymphoma is unique, and your medical team can provide personalized advice based on your specific situation.